Well, check out this stat. The world of wearables is exploding. You're in for a treat. Our next session, these visionaries will change the way you think about wearables. In fact, their ability to innovate outside the box is what this show is all about. Please welcome Tony Chahine, CEO of Myant, who will be leading this session and getting a little intimate with us by showing us his undies.
Thank you. Okay, well, maybe I should start by introducing our panel. First of all, my name is Tony Chahine. I'm the CEO and founder of Myant. Myant is a Toronto-based company and is in textile computing. And Suraj is a physician with Mayo Clinic, Suraj Kupa. Maybe Suraj, you want to come in and...
Thanks, Tony. So welcome, everybody, and we're happy to start the session today to focus on a title that might not make intuitive sense when we're starting it, but I hope by the end of the session you'll start understanding what we're talking about when we talk about smart textiles and the potential implications of these in terms of how we provide care to all. So again, my name is Suraj Kappa. I'm a physician at the Mayo Clinic in Rochester, Minnesota. I'm a cardiologist by trade. And I'm going to talk about some of the challenges to lay the foundation for what we're talking about today. And we know that healthcare has a problem. The reality is that providing care to more than just the patient that shows up in my office is difficult. There's only one of me. I might be able to see anywhere from 12 to 25 people in a day, but what about the thousands to millions of others around me that I never see and that can never get an appointment? How do I provide care to them and make sure they continue to do well? And we have to wonder, is modern healthcare about improving health or treating disease? In the world, about 50% of the human population never sees a physician between the time they're born and the time they die. The reality is most people don't come and see somebody until they have symptoms, until they feel poorly. And because of that, we lack the ability to prevent disease. And historically, however, we've relied on the physician, on your local healthcare giver, to engage with you to provide healthcare. But again, we're just not that scalable as far as human-directed resources. In the US alone, 80% of Americans admit they delay or forego preventive care. This might be because it's too hard to go in and see a doctor. It might be because you feel relatively well and say, I'm feeling pretty good. I can wait for another year. That becomes 5 years, then 10 years, and 20 years until you have chest pain and have a heart attack. Almost a quarter of Americans don't even have a personal doctor. Who are you going to go see, even when you're feeling poorly? And on average, in the US, Americans visit the doctor 4 times a year, which is less than other countries. And it's worse in many other countries in the developing world. And the question is, how do we provide care to all these patients, to all these people? Because the reality is the majority of the population, the majority of people are not patients. And this is where we need to get to. We need to democratize knowledge to improve health. We can't just be sitting there talking about what's the next tool that I can prescribe or what's the next technology that I can get insurance to cover. We need to think about how do we reach people where they are. And what's enabling the potential ability to achieve this is the rapid improvements in computational power, material science, and technology at large to make tools that are cheaper and can access information about an individual's health through seamless interfaces that are actually affordable and can be directed directly to the consumer. I'm going to give one example of this, work that we've been doing at the Mayo Clinic. And this is an electrocardiogram for those who haven't seen it before. This is a very simple tool that we're able to actually obtain pretty cost effectively, and many have seen consumer-directed tools that get an electrocardiogram, either as a single lead or a multi-lead form factor. It can be purchased on Amazon or online, direct to consumer. But we think of this and we say, oh, well, this is just for rhythm. This is just telling us if you're in normal rhythm or not. Everybody here has probably heard about atrial fibrillation. But we've learned through applying artificial intelligence, neural networks to large amounts of data, we can get more insights about the human physiology than beyond the rhythm itself. We can figure out if somebody has a low heart function. But 8% of the population has a low heart function but are asymptomatic, though there are medications to treat it. We can determine, even if you haven't developed it yet, whether you might develop atrial fibrillation and might thus be at increased risk of stroke in the future. And what's even more interesting, and this would be nothing I'd ever hear in medical school, I can determine what your actual biologic age might be. In other words, how old are you physiologically? Not just how many years have passed since the day you were born, but maybe how many days you have left before the day you die. And with each of these, we've shown with a high amount of fidelity, a perfect test that's right 100% of the time, has an area of the curve of 1. We can actually determine if you have a low heart function just from a simple ECG with an area under the curve of 0.9, your risk of AFib from an otherwise normal-looking electrocardiogram with an AOC of almost 0.9, and your physiologic age. This is an example of an individual who, when they were in their 30s, looked like they were in the 50s to 70s. And that was because they had multiple heart attacks. And then all of a sudden, their age fell because they had a heart transplant. And their age continued to fall as they got healthier, lost weight, and their underlying physiology improved. So the fact is, we're able to go beyond human interpretation with a combination of physiologic signal acquisition through our relatively low-cost tools, along with artificial intelligence. And we might be able to replace a lot of those more expensive tools that you need to see a physician or a healthcare system for. In other words, we're trying to combine clinical intelligence with machine intelligence to achieve a sort of medical intelligence, a higher level field that will allow us to improve healthcare for not just those people who are patients, but for people everywhere. And this is where the physician and the patient relationship becomes much more actuated. But the question is, how are we going to achieve this? What form factors are needed to actually get there? And with that, I'm going to hand it over to Tony to talk more about what these opportunities might be.
Thank you. So, this is not underwear. In fact, this is not just an underwear. It is an interface that connects you to your body, to your circle of care, and to AI. You see, connectedness, the way I see it, is a fundamental need for human well-being. And it is the foundation for success to digital health in the future. It takes a village to have adoption and efficacy successful. And in a small town, the way we used to live, we were all connected. We all shared our care. We all checked on each other. And what we are trying to develop, we're trying to develop interfaces that can simply bring back that old way of living into today's life. You see, we need an interface that is simple, it's around us, anywhere and everywhere, across our work, sports, in our car, at home, in our office, regardless. Something like healthcare should be around us, not an episode we have to go after. It should be there ambiently, close to us, anytime we need to. It needs to predict, it needs to anticipate, it needs to be like a guardian angel. And for that interface, we see the following requirement. It has to be ambient, it has to be continuous across the 24 hours without changing any of our habit. It has to be frictionless. And definitely it has to be passive. You don't need to do anything. And it has to be inclusive. It has to cover 100% of the demographic. So the solution we see that can play a significant role, in addition to other devices and other IoT we see on the market, a very important solution we see going forward is textile. And thanks to the advancement of technology and material science, textile today could truly be an interface where engineers and medical practice could rely on it for scale and reliability and efficacy and accuracy. So why textile? I say it again, it's already here. It's covering all of us right now. We're sitting on textile, we're wearing textile, we walk on textile, we sit on textile, and it's covering 100% of the demographic, but also 100% of the time, or close to 100% of the time, and uniquely, more than any other interface, it covers a very big portion of the body. So some of these interfaces are familiar to all of you. These are everyday textile. They're not some textile you wear for a specific occasion. That's a textile. In this case, it could be a polo shirt. You could wear a polo and an underwear at any given time. If you wear a polo and an underwear, you could have 2 or 3 leads of ECG. You could have sensor fusion, different biomechanics. If you're sitting on a chair, the chair itself could detect your posture. It could detect your temperature. It could deploy heating. It could also measure your ECG. So all of those interfaces are there in order to create truly an ambient intelligence around our need. The point of all of this is to make technology morph around our need, as opposed to us have to learn about the technology. So in order to make this happen, as I said before, we had to develop a complete end-to-end facility to take right from the raw material, from material science, all the way to yarn or fabric. From fabric, we brought data scientists, engineering, and very unique type of assembly. These are very advanced robotic knitting or technology to assemble this product, because you can do all of this in North America or in developed country. You don't have to go to cheap labor because it requires the least amount of labor. So once we put this interface, whether it's an underwear or a t-shirt or a bra, you could have, it's like a layering system. The same way we dress, we have a bunch of layers on us. Each layer could have a purpose, an underwear for one purpose, a shirt, a bra, a jacket. So you can, with each interface has a different features. They can morph. You can have biomechanics, biochemistry, electrophysiology, and hemodynamics, all in one interface. So someone with comorbidity, they can have one universal access to one place. Currently, essentially this interface will act like a DSL cable to your body. And currently we measure on our platform various sensors or various sensing, whether it's EEG data or ECG, different leads. We can measure drug efficacy, temperature, respiration, but at the same time, our interface is bidirectional. It can react. It can deliver stimulation for stroke rehab, for pain. It could deliver heating for arthritis pain or for comfort, and various different things. The way the data flow is very similar to any device. The textile, in this case, one or multiple textiles on your body, will go through one gateway. It can go to your phone or a desktop, and then it go to your cloud, and you can decide to share the information with your circle of care, with your physician, or it could be with your family and coach. So this way you can distribute your plan, and you can involve your family in your plan, whatever your plan is. And the application of this interface is available in healthcare, in industrial application for workwear, in transportation, and definitely in performance. The whole point of all of this, you see over here, all of these applications today have very little to do with healthcare. But the way we see it, things have to be slightly different. Because of healthcare need to be very close to us, we see this interface beaming our data on a continuous basis in order to truly have preventative healthcare. This slide, for me, represents the reason why we started Myent. It's the people who cannot participate with devices that require conscious or require an input. So, people with dementia, people with inability to speak technology or to deal with technology, they're often left behind. They're often not part of the society that can participate in the same way some of us can or could. So it's extremely important. The way we see it, the interface we're trying to build is to cover 100% of the population. A good example how one could use our application, this is an example of a daughter checking on her dad who's living in a remote town. She can check on her dad's sleep continuously or anytime she wants to. She can check on heart. She can check on if he's doing his activities, if he walked, if he's taking his medicine, all in one platform. So essentially what we're doing is we're creating the foundation of a new dimension of human presence. And thank you.
Thanks, Tony. So we're basically hearing a Maya-inside story evolving here. But to take this a step further and talk about how we utilize this, Dr. Daniel Kraft, Chair of Medicine and Neuroscience for Singularity University and a true futurist and leader in the evolution of healthcare, is going to talk a little bit more about artificial intelligence in this space. Daniel?
Thanks. So, I mean, this is a pretty incredible convergence of technology. The fact that, what used to take a supercomputer can fit inside our underwearables. And I think, the theme of digital health and medicine is bringing these technologies together in new ways and connecting the dots to help us cross the healthcare paradigm to move from our era of sort of sick care to true proactive healthcare. And clearly, if you walk around CES, and certainly emerged over the last decade, we're seeing the ability to collect data from all sorts of new spaces, including now in our textiles and clothes and beyond, and it creates a whole new paradigm shift of what we can do with that moving into the future. There's challenges. We're now going to be in an era where we're online 24/7 with our digital health exhaust, creating terabytes of data per day. What do we do with that? If a patient comes to me in the clinic, I don't just want their data. I want to understand what that means in the context of that individual patient. And so the real challenge and opportunity, whether it's AI, machine learning, big data, whatever you want to call it, is to start really to connect these dots so they become meaningful for the individual, where they are, who they are. And really to move the needle from, again, just being proactive, preventative, even to optimizing our health and wellness to extend not just our lifespan, but our health span. So now in this world of connected textiles, wearables, omics, big data, immunomics, how do we, as a clinician, as a patient, as an individual, start to make sense of that? And I like to summarize that as we're moving from our era of sort of the wearable on our wrist or watch, the quantified selfers that many of us are, to an era of quantified health, where this will start to flow continuously to your AI clinician, your nurse, your physician, your healthcare system, to enable us to better measure and optimize our health, to better do early diagnosis, your ECG in your underwear, picking up a problem early, and then if you have a disease from diabetes to cancer, to better have a feedback loop to treat that. So the challenge and opportunity is we've even had folks in the wild wearing connected textiles to wearables, and now we're starting to see projects like Project Baseline out of Google or the All of Us project out of the NIH starting to map real digital health data coming from well and unwell patients. And as we pull that data together, it's going to increasingly require AI, or I like to refer to it, IA, intelligence augmentation, to make sense of that. And that enables all of us to upskill this information to make it useful, whether it's for diagnosing retinopathy or reading an EKG, which I was never good at, to really synthesize this into an era of each of us having our own sort of digital twin, integrating our textile-based connected information, our real-time, basically digitome that we're going to be extruding 24/7. And as we take this further, what do we do with that? What's the so what? We talk about intelligent healthcare. I'm building a way to 3D print intelligent medication, so you could take your data from your connected chair, wearables, and beyond, and modify medications when they're needed. This will not, of course, supplant the need for clinicians, nurses, and others. We need to blend what humans and machines can do moving forward. There's that often used quote, AI is not going to replace the clinician, but the clinician who uses AI will replace those who don't. And increasingly, the clinicians will be supplanted by folks who have less and less training. So we can really start to democratize healthcare around the planet. So it's going to be this sort of synergy moving forward. And a real opportunity now is with this exponential data is to turn that data more quickly into real information, turn that into actual knowledge, and bring that into clinical utility that we can have proactively in our homes, and increasingly as we take healthcare outside of the four walls of medicine. And the future of that, I think, is this idea of sort of predictalytics, integrating this massive data to make it individualized information, to give us our own personalized wellness indexes or disease indexes, so that we can, again, get early warning, kind of like the idea of your own personal check engine light, and so that the power will be, platforms like Maya, having systems integrated across our care paradigm to sort of be a little bit of an OnStar for the body, to give us guidance, kind of a GPS for healthcare that's tuned and personalized as we go. So I think it's a really exciting era. This era of smart textiles, I think, is going to really accelerate that moving forward, and I encourage all of you to start building that into your future plans. Thanks.
Thank you.
Thank you, Daniel. And I think these insights are phenomenal. And I'm going to introduce now Martha Peace, who has been involved in the tech sectors across multiple platforms, from Apple in the days of Steve Jobs and marketing the original computers, with IBM, with Domino's, which she recently informed me was a tech company, and is currently a partner director at BCG. And she's going to take the last step of this pathway, the kind of B2B to C element that runs into how do we actually reach from this innovation through these analytics and predictions all the way to actually enabling the consumer. Martha?
Thanks, Raj. So it's an amazing world that we're facing right now. I mean, we're really on the verge of an unprecedented category in the healthcare area. But it does remind any of us who have been in tech about other fragmented categories that have had to go through a number of different cycles to really come to some solidified place as a business model and also as a real provider of services to customers. And so when you think about this, if you kind of shift now from the context of being able to develop the technology and apply the data to what does that really mean for commercializing and creating value for the end users, there are certainly a lot of parallels in categories that are more mature and that have enormous track records in developing customer relationships and exploiting actually unmet customer needs and behaviors. So one of the things that we should think about as we move into this brave world are some fundamentals that we can draw from customer and consumer-oriented sectors. And these are, I would say, 5 pillars to think about as anyone is either working to develop technology in this area, to market in this area, to look for strategic partnerships, any aspect of building a business in the area of connected care and virtual care. And the first is, and this is not something that's really common in healthcare in general, and also not in technology, but the first is this idea of end-to-end customer journey experience management. We think about patient management, or we think about provider management, or clinician management in the healthcare sector. But as customers, if you think about any of us in our lives, we are healthcare consumers across the entire course of our lives. We're not always a patient. In fact, we may rarely be a patient if we're healthy. But nonetheless, we're consuming health, wellness, preventative, we're engaging and transferring our data willingly or unwillingly to other places. We are engaging in an end-to-end journey as healthcare consumers. And every stage of that journey has some common phases associated with it. There are pain points. There are moments of truth that if the pain point can be converted to something that actually enables whatever it is that I want to experience is a moment of truth. There are touch points that we would prefer to be engaging with, and there are moments where we want to be intercepted, and there are moments when we don't want to be intercepted. And all of those can be understood at a quantitative level. There's vast amount of data that you can bring to bear to create insight around that end-to-end journey management and the experience that people want. And you can also use that end-to-end experience management to define, you can use it as a strategic filter really for the kinds of initiatives that Tony's describing to really align where you're going with innovation and technology so that you can capitalize it at the moments of truth along that journey. The other issue that's really crucial particularly in this area of healthcare today is the idea of a clear value exchange. Because at every point along the way, we're asking us to give data over in some way, shape, or form. And the closer these kinds of initiatives get to actually dealing directly with customers, the more relevant that value exchange and the insight around that value exchange is going to be. So for example, if you want me to give up my data, what do I want in return? Do I want control? Do I want a sense of confidence? Do I want a sense of protection or privacy? Do I just want the problem fixed? What's the condition in which I'm going to make a decision to give up, in fact, my data and to allow you to use my data, which is ultimately the engine of the innovation behind this category. So the clear value exchange and really understanding how to leverage what you can bring to the market against an unmet need that creates value for a customer is crucial. The third area is, and we see this in technology, we know it, but it's particularly relevant to how connected and virtual and remote care unfolds, is the idea of going from product, which is, we have a piece of technology that we can commercialize right now near term because it's new and different and we can build it into some kind of innovative context. But taking that and making it a sustainable proposition in a fragmented category with the kind of complexity that you find in healthcare, with the kind of complex stakeholder systems, is very difficult. And the abiding strategic view that creates middle and long-term sustainability is to build product into platform, and particularly in this case, platforms that accommodate third-party data and accommodate and really have an engine of strategic third-party partnerships behind them, whether they're provider partnerships or manufacturing or supply chain kinds of partnerships. And then the idea of business impact sounds kind of amorphous, and well, yes, of course, we need to have performance against this, but interestingly, profitability is not necessarily something that goes hand in hand with tech development or innovation in healthcare. And so just at a very macro level, the challenge of creating business impact is significant. One of the huge promises, obviously, of virtual and connected care is that you're able to scale and create new markets. So you can suddenly have access to a volume of market scalability that you didn't have before, but you've got to connect how you go after that scalability with the kinds of outcomes that customers need. So we think about cost, we think about efficacy, we think about shortening times or increasing volume. In a customer environment, in a direct-to-customer environment, things like confidence, reputation, trust, belief that you are on my side and want to help me, those are also builders of equity and need to be measured and can be tied directly to impact. And ultimately, what we're trying to build in this kind of area are the fundamentals of long-term sustainable equity that you can build a business around, not just a product or a technology. So.
Thank you. You can ask one question.
Okay. Thank you, Martha. So, in the last 10 seconds, we're at 2020 now, and in one sentence, I want each of you three, based on everything we've talked about, to give your thought on what we're going to be thinking or talking about in 2025. So, and what's the problem that we're going to have to overcome, and what's the opportunity we're going to be seeing at that point? Martha, I'll start with you.
Well, I think in 2025, we'll be seeing a category that is still shaking out, with a lot of still emerging technology around it, but with far more certainty around how we can get control over our healthcare using innovation that's out there, and also how we can control how our data is used and what the impact is of the use of that data.
Great. Daniel?
I think by 2025, we'll start to see more of this convergence of this fragmented set of bubbles into something that's useful, personalized, a bit of your own personal healthcare kind of shares that takes you through your healthcare journey from health and wellness even into disease, and that data becomes crowdsourced and shared, so we're all upskilling everybody continuously.
Great. And Tony?
And I think by 2025, access to AI from anywhere and for anyone will be very important and will be achieved. And people will start understanding a lot more about their health and their body. And they will start, things will start really becoming preventative and anticipatory.
Wonderful. Thank you, everybody. And I appreciate your attention.
Thank you.